So my name is Kate Sedlacek. I am nurse practitioner with Forefront Dermatology. I have been with this clinic for 5 years, but in dermatology for the last 15 years. So skin cancer is abnormal, rapid growth of skin cells that can happen in any layer of a skin. So the most common type of skin cancer is a basal cell skin cancer, squamous cell skin cancer, and the last one is melanoma. Melanoma is the most common childhood skin cancer, or it's actually the most common childhood cancer, period, hands down. So type 1 and type 2 are skin color people, which means redheads, blue eyes, blondes, blue eyes, green eyes. However, skin cancer is also found in people with darker skin as well as African Americans. The predisposition for skin cancer could also come from repeated sunburns, especially before the age 18. So that's when we accumulate most of the sun damage in our lifetime, and later on in our life we maintain the acquired damage. So therefore, someone who is a sun worshipper and burns every year repeatedly, those are the people who have the highest risk. However, people who had kidney transplant as well as any other organ transplant and take medication that suppresses the immune system, they also have a very high risk of developing skin cancer, as well as people with skin conditions such as psoriasis and eczema because of the dysfunctional and already affected skin barrier. So the diagnosis happened through a visual assessment as well as biopsy that is secondary to visual assessment. So we look at the growth that changes or it's abnormal, and then we do biopsy, and the biopsy confirms the type of skin cancer as well as the depth and also the changes in the cancer itself, so if it's infiltrative or superficially spreading, etc. So the most common treatment for skin cancer is excisional biopsy or excisional of the cancer with the healthy skin margins. If the skin cancer are further progressed in the tissue, we also check lymph nodes for melanoma that it has certain depth, and we also do chemo as well as radiation for more involved skin cancers. So the side effect of treatment is scarring. The skin cancer are probably the most disfiguring type of cancers because a lot of the very common skin cancer happen on the face, ears, neck. So once we remove the skin cancer, there's a visual scar. But scarring as well as tissue atrophy, so skin atrophy or discoloration, those are the most common side effect of removal of skin cancer. Melanoma, yes. So every patient who gets diagnosed with melanoma should bring the next kin relative, so children, siblings, parents, for full body skin check because we worry about the heredity of melanoma. Some of the squamous and basals are now being looked as possibly hereditary. There are some type of skin cancer where there is a possible genetic component that makes you more prone to develop these cancers. So definitely don't get any sunburn anymore, which not means particularly to completely avoid the sun, because we know that there are certain benefits of the sun. So it's okay to practice safe sun, but don't burn anymore. And having a yearly full body skin check, it's probably the best prevention moving forwards after the diagnosis, to make sure we have an early diagnosis, quick diagnosis, and we catch things early before they progress and become skin cancer. I always tell my patient the best SPF is the one that you reapply every 2 hours, because most of us, especially women who use makeup, put stuff in the morning, and by about 10 a.m. there's absolutely no protection on our faces. And a lot of us are really good at applying sunscreen when we go to the beach, or we go to the lake, or we're going to be outside, but we miss those times when we go to the grocery or hang out with the friends during a lunchtime in the outdoor cafe. So the key is the reapplication of the sunscreen, not so much the number. The American Academy of Dermatology changed the labels, actually made the manufacturer change the labels, because there was a common misconception that the higher the SPF, the less I have to reapply. So I recommend 35 and higher. On the face, I like the 50s and every 2 hour reapplication. Why are you seeing dentist for your teeth? Because we see naked people all day long, and we look in every nook and cranny, and we find things that may be missed by other providers that assess the patient once a year for, let's say, blood pressure or high cholesterol. That's what we do all day long, look at people and assess them for skin changes, as well as utilizing specific equipment that allowed us to look a little bit deeper into the skin lesion to recognize those early changes. So I was diagnosed with ovarian cancer 23 years ago. I was 21 at that time, and I was in complete denial. Probably the hardest question I ask myself, because as a cancer survivor, you always have this in the back of your mind that it may come back, maybe come back in a different body part. And I ask myself this question: how would I react today after I have children and I have more at stake than being newly married 20-something years ago, where there was not that much to lose? So I think being a fighter and to never give up, and just tell yourself every day, I'll kick the cancer's ass, and just don't give up, no matter how hard it gets, no matter how many times you get confronted with the medical establishment, pain, surgery. Just grit your teeth and fake it till you make it.